Support a county funding contribution to assist the Sonoma West Medical Center provide emergency room care to indigent patients. There was a contract with Sutter to do that in its old location. They used to have a county hospital. In fact, it's founded in 1859. The first county service that was provided was a hospital. And now Sutter has moved its location to where it's not accessible by people who are homeless or people who are indigent. And that contract has expired, and there is no facility or capacity for the county to fund emergency room care or indigent care as it's mandated, by the way, in state law. So,
I do believe it is our moral responsibility to provide emergency care. I actually work as an eligibility worker at the Medi-Cal offices, and under the Affordable Care Act, people who once upon a time would not have been eligible for Medi-Cal or Medicaid, as it's known on a national level, is they increased it to 138% of federal poverty level, and it didn't matter whether you are male, female, single, have kids, because a long time ago, well actually 3.5 years ago, if you fell within, if you were single, male or female, and you fell between the ages of 21 and I think it was like 50, you were not eligible for standard Medicaid. And under the Affordable Care Act, they've actually expanded that so that there's really no reason that any indigent person, if they're here legally or illegally, should not be covered by Medi-Cal, because even people who are here without what's called PRU-Call, under cover of law, even if they're not here under cover of law, they can get Medi-Cal for emergency services, and it's covered by the state of California. So what we have a lot of the hospitals doing right now is, as soon as somebody who doesn't have insurance shows up at their door in their emergency services, is they apply on behalf of that person, and the paperwork comes directly to our offices, where then we can process it, and it gets processed from the date that the application by the hospital is written. So if the hospital does it April 1st, and we don't get to it till May 1st, we actually make the eligibility go back to April 1st when it was first started. In fact, with Medi-Cal, there's 30 days in the month of April. You could have applied on the 28th of April, been in the hospital on the 25th, but the way Medi-Cal works is, if you're in for a penny, you're in for a pound. So it goes back to the very first day of whatever month you applied. So I would try to get more outreach eligibility workers. We currently do have outreach eligibility workers in some of these community-based clinics in order to sign people up, but there's still a lot of people who don't know this. So I would do that route first, and then any shortfall then could be made up by the county.
Thank you.